Hello, I am here with Stephen Kulesza to discuss his article, Hydrocortisone versus Vasopressin for the Management of Adult Patients with Septic Shock Refractory to Norepinephrine, a multicenter retrospective study. How can pharmacists leverage this research to optimize patient outcomes?
Well, when we talk about the management of septic shock, pharmacists play a key role in not only which medications to use, but when to use them. Looking at the 2021 update to the Surviving Sepsis campaign guidelines, our primary interventions include broad-spectrum antibiotics, fluid resuscitation, and norepinephrine as our first-line vasopressor. After that, there's a lack of strong evidence to guide both selection and timing of a second agent, but hydrocortisone and vasopressin are both listed as reasonable evidence-based options. Prior to our research, this decision was mainly based on clinician preference and expert opinion. But with our multicenter retrospective study, we were able to show that the addition of hydrocortisone to norepinephrine was associated with a lower 28-day mortality in patients with septic shock compared to the addition of vasopressin. Personally, I feel like steroids are an underutilized part of the septic shock treatment algorithm, possibly due to their lack of direct vasopressor activity when clinicians are faced with a hemodynamically unstable septic patient. This study provides pharmacists with valuable insights on the benefits of initiating hydrocortisone early in the disease process, namely through reducing mortality, reducing recurrence of shock, and also length of stay. Further research will be required to establish optimal utilization of both vasopressin and hydrocortisone in the septic shock treatment algorithm, but this piece of pharmacist-led research provides many opportunities for future hypothesis generation. Sharing these research findings with other healthcare providers not only translates to improved patient outcomes, but it also helps solidify the role of the pharmacist within the healthcare team.
Where do you see your research headed in the future?
While our study supports the use of hydrocortisone over vasopressin, more research has to be done to evaluate the simultaneous initiation of both agents. Comparing simultaneous initiation to individual use of each agent may help shed some light on any potential synergistic effects of vasopressin and hydrocortisone. Also, the timing of vasopressors and adjunctive agents in septic shock have been evaluated as factors influencing patient outcomes with a trend towards earlier initiation in the disease process. For example, norepinephrine dose and lactate concentration are both markers that can help guide addition of hydrocortisone, vasopressin, and more recently angiotensin II in patients with septic shock. But again, as more research is done, it'll help shape a simplified treatment algorithm for septic shock, which has real-world applicability.
Congratulations to you, Stephen. It was certainly a pleasure meeting you and learning more about your research.
Thanks, Kelly.